following video is sponsored by Utopia Silver Supplements. utopiasilver.com. Teaching, Learning, and Caring for Your Health. Hosted by Dr. Ken O'Neill, MD. Dr. Ken's topic today, iodine replacement therapy.
Hi, this is Dr. Ken O'Neill with another episode of Teaching, Learning, and Caring for Your Health. Today we're going to talk about iodine. For many, many years, even since the Civil War, American physicians have known that iodine is an essential element and that it's necessary for good health. Here's a little bottle of Lugol's iodine. This kind of iodine was used by American physicians for almost 100 years, from 1861 to 1961, and the majority of physicians in the United States up to that point used Lugol's iodine for the patients, not just for thyroid problems, but for many other ailments as well, with great success. Now, the RDA in America is 100 micrograms, which is 1/10 of 1 milligram. But there are many indications and research that shows that this is far too small of a level. In recent years, there's been a sort of an iodophobia in America, because formerly iodine was even put in bread, just like it's put in iodized salt. But about 20 years ago, due to the fear of excessive iodine, quote unquote, it was taken out of the bread, and in its place bromide was put, which is a thyroid toxin. Now, the body, when it has fluoride, chloride, and bromide, which we have through our drinking water and medicinals and other things, it's hard for the body to get rid of excess halides, which are all very caustic and hyperreactive, without having iodine saturation in the body. Now, compared to our RDA, people in Japan take 12.5 milligrams a day in their diet. That's milligrams. That's 12,500 micrograms. That's compared to our RDA of 100 micrograms. Now, in the United States, one of the top researchers and brilliant physicians, Dr. Guy Abraham, MD, former endocrinologist and professor who taught on the subject of iodine and other endocrine glands at the UCLA Medical School. And also now he has his own company and continues to do research on iodine. He and several medical colleagues did a project called the Iodine Project, in which they checked 4,000 patients with high-dose iodine therapy. Not only did it not hurt them, but it helped various conditions, such as goiter was reduced and eliminated, pituitary stress was eliminated as indicated by lower TSH readings, thyroid-stimulating hormone. They found increased excretion of the fluoride, bromine, and chloride, as well as heavy metals. Lead, arsenic, mercury were excreted in much larger amounts when the body was saturated with iodine. Liver's detoxification mechanisms were improved. Diabetes was much better controlled and much easier to control when the patients had saturation of iodine in the body. Blood pressure as well was much better controlled. Fibrocystic breast disease was resolved in some cases. Brain function was better. Patients complained of less brain fog, and cancer rates, especially thyroid cancer and cancer of the breast, were reduced. Now, we know that you can test your body for the amount of iodine you need in a real simple way called the iodine test. We have a short video of that which demonstrates how to do that. The results of the skin test with iodine correlate very well with the 24-hour urine, the more technical, scientific, and medically accurate test. That was also developed, by the way, by Dr. Guy Abraham. As with any kind of therapy, proceed slowly with the help and support and recommendations of your chosen healthcare provider, naturopath, medical doctor, or whoever helps you with your health issues. So, this very, very important nutrient in the right amounts can make major improvements in your health. Why not check out for yourself the information about this on the website, learn how to test yourself for it, and then give it a try. I think you'll be glad you did as you see improvements in your symptoms. I'm now going to demonstrate how you can test yourself for whether you have enough iodine in your body or not. It's called the iodine patch test. You simply take a bottle of Lugol's iodine or of another form of iodine. You put some of it on your skin, let it absorb into the skin. An area about 1 inch square is sufficient. Kind of like that. Of course, you let it dry. You can see the reddish brown color of the iodine here. And how to interpret the results of the test are, if all of this color is absorbed through your skin and into the body in less than 8 hours, you have a very severe deficiency of iodine in your body. 8 to 16 hours you have a moderate deficiency, and 16 to 24 hours you have a slight to moderate deficiency. Only if it takes 24 hours or more for this to slowly fade away does it indicate that you have enough iodine in your body, which, according to Dr. Guy Abraham, is 1,500 milligrams total quantity of iodine in a fully saturated iodine patient. So, this is a simple way, and although it is easy to do, it apparently correlates very well with the much more scientific, medical, and technical way of testing for iodine, which is to take a loading dose and to check a 24-hour urine to see how much of it you dump out of your body. The rest of it, presumably, having been absorbed into your tissue. This is an easy way. You can do this test every 1 to 2 weeks as you're trying to do your loading on the Lugol's iodine, as outlined by Dr. Guy Abraham, MD, and Dr. Jonathan Wright, MD.